Cervical cancer, though often overshadowed, remains a significant health concern for women globally, yet it is largely preventable and treatable. Every year, hundreds of thousands of women are diagnosed, and thousands tragically die, often due to a lack of awareness about early warning signs or missed screenings. In this video, we will explore what causes cervical cancer, the symptoms to recognize, effective prevention strategies, and the available treatment options. By understanding these crucial aspects, you can take proactive steps to protect yourself and the women you care about. Cervical cancer originates in the cells of the cervix, which is the lower part of the uterus connecting to the vagina. Most cases are squamous cell carcinomas developing from the thin, flat cells lining the cervix, while some are adenocarcinomas arising from glandular cells. This disease typically progresses slowly over many years, often beginning with precancerous changes known as dysplasia. The primary cause of cervical cancer is persistent infection with high-risk human papillomavirus, or HPV, particularly types 16 and 18. HPV is a common sexually transmitted virus, and while most infections clear naturally, persistent high-risk types can lead to cellular changes. Other risk factors include smoking, a weakened immune system from conditions like HIV or long-term steroid use, and multiple full-term pregnancies. Long-term use of oral contraceptives and early sexual activity also contribute to increased risk. It's important to note that not every woman with HPV will develop cervical cancer, but the virus significantly increases the risk. Early-stage cervical cancer often presents no noticeable symptoms, making regular screening absolutely vital for early detection. As the cancer progresses, symptoms may emerge, including abnormal vaginal bleeding after sex, between periods, or after menopause. Other potential signs include unusual vaginal discharge, pelvic pain, and discomfort during sexual intercourse. Because early cervical cancer is often silent, screening remains the most reliable method for detecting it at its most treatable stage. Prevention is key, and HPV vaccination is a powerful tool, protecting against high-risk HPV strains. Vaccines are most effective when administered before sexual activity begins, typically recommended for children aged 11 to 12 years. Regular screening, through pap smears and HPV tests, is crucial for detecting precancerous changes before they develop into cancer. Guidelines suggest cervical cancer testing should begin at age 25, with primary HPV tests every 5 years. Alternatively, a co-test combining HPV and pap tests every 5 years, or a pap test alone every 3 years, is recommended. Safe sexual practices, including condom use and limiting sexual partners, can reduce but not entirely eliminate HPV risk. Maintaining a healthy lifestyle, avoiding smoking, and supporting your immune system also contribute to prevention. If screening reveals abnormal cells, a colposcopy may be performed for a closer examination of the cervix, followed by a biopsy to confirm diagnosis. Cancer staging, from I to 4, determines how far the cancer has spread, which is critical for tailoring the most effective treatment plan. For early-stage cancer, treatment often involves surgery, such as LEP or cone biopsy, to remove precancerous lesions or part of the cervix. More advanced cases may require a hysterectomy, radiation therapy, chemotherapy, or a combination of these approaches. Emerging therapies like targeted therapy and immunotherapy are also showing promising results for advanced cervical cancer. Early detection dramatically improves survival rates, with nearly 100% survival in early-stage cervical cancer. Cervical cancer is largely preventable and highly treatable when caught early. Vaccination, regular screening, and awareness are life-saving. If you're eligible, get vaccinated, schedule your pap smear, and encourage the women in your life to do the same. Cervical cancer doesn't have to be deadly. Awareness and proactive action are your best defenses.